Hi, everyone, and welcome to NDD's webinar. It's called a Virtual Roundtable with NDD. My name is Jamie Burgess, and I'm an RT with NDD. And my name is Darren Fitzpatrick, and I'm also an RT with NDD. Joining us today are the members of our NDD sales team. We actually have one right next to us. It's Danielle.
Hello.
We will get in their introduction shortly, but go ahead, Jamie. All right, a little bit of housekeeping. So as always, there will be a questions tab open on the sidebar. Still feel free to type your questions at any point during the presentation, but we're actually going to do kind of a little bit different, a special live Q&A towards the end of our presentation, where we'll kind of take turns going through those questions and answering them as a team. There will also be a post-webinar email as usual that will be emailed out to you. This will have contact information for the team, Jamie and myself, for the questions that may come up afterwards. There will also be a recording in this webinar. Awesome. So objectives for today. So first, we're going to do something a little bit fun. We're going to meet the NDD sales team. Then we're going to go into how the sales team, how they're helping customers across the U.S. open. You know, every region's a little bit differently, so we thought we'd kind of go through the team and just hear how different places are handling opening during this time. We're also going to discuss your most frequently asked questions. We had a question bar on the registration form and got some good questions, so we're going to go through those. And then, of course, that live Q&A section that I mentioned earlier. So without further ado, I love this picture of our team, but we're going to go through and introduce everyone, and we're actually going to start with Darren. So again, my name is Darren Fitzpatrick, and I'm a respiratory therapist, and I'm also now the U.S. Director of Sales. I've been with NDD almost just shy of 11 years. We currently live in Southwest Missouri and obviously live near Jamie and Danielle, so we call it the Missouri NDD team. But I have 4 children ranging from ages 8 to almost 9, busy with sports, always on the go, but spend most of our free time on our boat and just love to be a part of the NDD team. Awesome. Well, mine is next. Again, my name is Jamie Burgess, and I'm also an RRT. I was in the clinical setting, ER and neurotrauma primarily before I came on board with Cox Health Systems here in Southwest Missouri. I've been with NDD just right at that 2-year mark. My first year, I did trainings with Darren. I did per diem training and then came on full-time last summer. I'm also living currently in Southwest Missouri. I went to RT school through OTC in Missouri State, and I have 3 kids, and I chase them around to all of their activities. We love to kayak, I love to sing and dance, and I also coach color guard and dance line for my kids' school, which is really fun. All right, next up is Jessica.
Hello, everyone. My name is Jessica Dietrich. I am currently the U.S. Training Manager for NDD, which is a new role. I've been with NDD for about 6 years. Previously, I was one of the regional directors on the sales team. I'm a respiratory therapist. I went to school at Quinnipiac University in Connecticut. I live south of Boston, so I'm in Massachusetts. I have a husband. I co-parent 2 children with him. We spend lots of time at the beach. Our daughter just left for Indiana University last week, so that's interesting. I have a dog, which is the light of my life most days. He's the best. But yeah, we spend a lot of time with the kids and at the beach and things like that.
Thanks, Jess. Awesome. Travis.
Hello, everyone. My name is Travis Treadwell. I'm the Western Regional Sales Director for NDD. I've been here for about 2 years, actually over 2 years now. I'm a military kid, so I moved around a lot when I was a kid. But I do call Denver home now with my wife and Basset Hound. I've been RT for 21 years now. 14 of those have been in the NICU, PICU area at Children's here in Denver. And I graduated from Dakota State University in South Dakota with respiratory school.
Awesome. Thanks, Travis. All right, Kaylee.
Hi, my name is Kaylee Martin. I'm the Southern Regional Sales Director. I'm originally from the Midwest, the Chicago suburbs, but I'm currently living in Arizona with my husband, and similar to Travis, my Basset Hound. I've been with NDD for a little over a year now, but I've actually been selling the product for over 3 years because I started with MedTech Medcare before I came on full-time with NDD. I have a BS from the University of Wisconsin-Milwaukee in environmental science and biology. My hobbies include running, riding my bike when it's not 115 degrees outside here in Arizona, and I love hiking and traveling.
Awesome. Thank you. All right, Danielle.
Hi, everyone. My name is Danielle Mock, and I'm the Midwest Area Sales Manager here at NDD. I've been with NDD for only about 5 months now. I started right before the pandemic hit us. I am from the St. Louis suburbs area. Originally, that's where I grew up. And I now live in Southwest Missouri with my husband and 2 dogs, who are my world. I graduated from the University of Missouri with my bachelor's in health science. And we really just enjoy watching sports a ton, hiking, getting outdoors, and I love dancing as well.
Thank you. Awesome. So what we want to do is take a few minutes to give everyone a picture of how PFT labs are reopening in the US. We get a lot of questions on how others are tackling this challenge. So we thought it would be beneficial to hear from everyone what they're seeing in their territories. Right, you know, the most recent guidelines released by ATS still really primarily focus on provider protection and provider safety. The constants with these guidelines throughout this entire time really have been the use of PPEs, including masks, gloves, face shields, following equipment cleaning guidelines, following infection control protocols that have been established with your facility. But again, you know, there's so many other things that come into factor. You know, NDD has a new inline filter solution. We've heard all different kinds of stories of how people, anything from negative pressure rooms to testing outside. We really have heard a really wide range from all across the country of how people are opening up. So actually, I'm going to start with Darren. Darren is covering the East Coast right now. And so we'll start with her and just kind of hear from each of the team members what they've been hearing from their neck of the woods.
Absolutely. And as everyone on this call knows, that the whole United States was obviously affected by this pandemic, but East Coast really took a hard toll on it. And so it's really been an interesting conversation to have with not only our reps who do a great job out there of helping facilities get up and running and introducing our double protection of a inline filter solution, but also talking to the challenges of what offices are facing with their patients. But week by week, it seems to be getting better. More and more physicians are opening their offices because patients need testing and they need diagnosis and they need treatment. So on the East Coast, it's definitely been slower than what I've seen across the United States. The more north you go, maybe the less the population, the less the number of actual cases. So it seems to be doing a little bit more than what you would think, more than what happens in New York City or maybe in Boston. But slowly but surely, they are opening back up, taking those extra precautions, making sure we always stress that the tech is protected, to make sure they're gowned up as much as they possibly can with face shields and masks, just to make sure that there's no any contamination going on. But I think the East Coast is coming. You can see that things are starting to turn back around. So
yeah, awesome. Travis, what about you? What are you seeing?
On the West Coast, or I'd say the western half of the United States, it's kind of a mixed bag. We have several states that don't have a lot of restrictions, so there wasn't a whole lot of stoppage for testing. But then I also have places like California that are still, some areas are on lockdown, so it's slow to open back up. Talking to a couple of accounts, some are just testing before COVID testing before they have them come in for PFT testing, and there are other offices that are basically using PPE along with our filters, or sometimes without our filters. That's kind of what I'm hearing on the West Coast. Depends on, like I said, which state you're in. Nevada, not so much. The Midwest states where there are no restrictions, you're seeing testing just going on. So.
absolutely.
Awesome. Kaylee, what about you?
Yeah, so similar to what Travis said, I really see a mixed bag. I cover from Arizona all the way to Florida, and every single state is really diverse and different. My bigger states that you know, that they're considered hotspots, Texas, Florida, they're really, they're only testing healthy patients. And I see a lot of clinics kind of having one clinic be for sick patients and then another clinic being only for healthy patients. And, you know, where they're seeing healthy patients, they are resuming spirometry testing. And then other states like Louisiana, Mississippi, Alabama, they never really stopped. They keep going, they keep testing. I have some facilities using filters, some using PPE, some a combination of both, and some are, you know, some aren't using the filter. But I have not really seen them kind of slow down. They continue to test. Same here in Arizona, we slowed down for a little bit. Actually, it was a delayed slowdown. Everything was pretty normal in May, and then in June, we kind of slowed down again. But I have a customer here in Arizona that they have a pro lab and they've never stopped testing simply because they say that, you know, they see a lot of cancer patients, and just because COVID-19 is going on, they said cancer isn't going anywhere. You know, they still have to test those patients and make sure that they're getting everything that they need. So that's kind of what I'm seeing.
Okay, awesome. Danielle?
Yeah, in the Midwest, I would say we are also seeing a little bit of everything, as Kaylee and Travis both mentioned. Some places such as Chicago are more shut down and they're opening up a lot slower than some other places. But I think overall we're really seeing everything starting to pick back up these last couple months, and I think the trend is just continuing to go up. People are starting to reopen and test more and more. I think our filters are providing them a level of comfort in doing so. I know Michigan, most all of their customers are very interested in our filters, and most are starting to use our filters. So I know, you know, that's just what they are doing, but it's a little bit of variety all over.
Right. The bigger cities obviously seem to be taking a little bit more time.
Right.
So, right.
That makes sense. I also wanted to take a moment to mention Jessica is actually going to be starting monthly webinars focused on specific device use, spirometry technique next month. And this can be a great resource for you if your office has been shut down or closed for an extended amount of time during COVID, or you can just use it as a staff refresher as well. Jess, do you want to give us some more information on those?
Yeah, so our first one will be scheduled for September 15th, and we're going to start with the Easy One Air. In October, it will be the Easy on PC. So what we're looking to do is just to give you a quick overview of the device and then go into how to perform a test. Just to kind of go along with the theme that offices are opening back up, and maybe it's been a while since you tested, maybe you've struggled and you never did close down, but you just need a refresher, or you've had some staff turnover like Jamie mentioned. This is something that we will be offering starting again September 15th, and it will start with the Air, and then in October to go to the PC, and we're going to kind of alternate the device, but it will be spirometry based. So we hope, you know, everyone can kind of jump on and join us if you have any questions.
And so, yeah, it's going to be great for those offices. We've seen a lot of offices buy more devices. It seems that with the PFT labs being closed, and Jess, I know you've been busy doing this too, is with more offices being closed, or PFT labs being closed, the offices are buying either more spirometers or another DLCO unit just because of the amount of patients that have been backed up waiting for testing. So that's also a great opportunity too, Jess, like you're saying, is they may already have an equipment, but maybe they're adding another piece to another office or some more staff training. So it gives those, you know, another training for another piece of equipment.
Yeah, exactly. We just want to show our support, you know, and train. Yep.
Awesome. Well, thank you guys so very much for that insight. We're actually going to move into some of these most frequently asked questions that we hear from our customers, from our reps. Some of these questions you guys put in your registration forms, other questions we pulled from customer support, what they're hearing from the field. So sales team, we're going to read through these, Darren's going to read through these questions, and absolutely, you know, anybody just jump in and answer, and we'll try to get these taken care of.
All right. Okay, so some frequently asked questions. And again, Jamie said we had sent out a questionnaire when we sent out information on this webinar. We also asked tech support, what are the questions you're getting? And the first one that came up is, what are the differences between the Easy One Pro and the Pro Lab device? It's actually a really great question. I actually answered that just a little bit ago.
Yep.
So the Easy One Pro is a device that we brought out 10 years ago. And what our main focus of that was the ability to have physician offices have the ability to do spirometry and diffusion testing right there, instead of sending the patient out to the PFT lab, because DLCO testing is a very simple test. It's an additional 10-second test, but it gives you so much information to look at that diffusion state of the patient's lung. So the Easy One Pro gives you spirometry, DLCO, and you are able to obtain single breath lung volumes from the DLCO test. The Easy One Pro Lab is what we brought out about 8 years ago, and we added nitrogen washout to give those complete lung volumes, and LCI, which is the lung clearance index, which you'll find cystic fibrosis centers that use that test. So again, the Easy One Pro Lab will give you spirometry, DLCO, and nitrogen washout for complete lung volumes. The Easy One Pro is spirometry and DLCO, and you are able to obtain some single breath lung volumes. Awesome. The question number 2 is, can you upload data from a competitive device to transition to an NDD device?
Right, and this was a very specific question that we were asked in our registration form. So if you're on this call, the person who asked that question, that's a great question, and I'll kind of skim the surface because it's a little bit of a detailed answer. I got actually with tech support to make sure that I could answer it for you correctly. But yes. The short answer is yes, you can. If you have a competitive device and are looking to transition to an NDD device, there is a way to upload data from that competitive device into your new NDD device. It's kind of a technical process. It is like a manual, like a batch update process, to where sometimes it takes a little bit of work to get the data, like the raw data from the machine, to be usable data in the NDD device. But again, the short answer is yes. If you're looking to transition from a competitive device to an NDD device, absolutely, shoot me an email. We'll get you guys in touch with customer service, and we can talk through that on a little bit more of a detailed level for you guys. But that's a great question, and yes, we can absolutely help you with that.
Another question is, what is the Easy One Connect? And that's our software. Right. So which is easily downloadable off our website. You can do it anytime, which leads us to the next question, which is, how do I know when the new software firmware is released? And we really try to get that out in newsletters. If you guys are registered with NED on our website, we also push out notifications. But you could always go to our website, and you can always check the firmware which is on your software or what's been released. Am I forgetting anything?
No, if you're on our pro mailing list, you'll get those updates in your newsletter from us. Right now, there isn't an option to just go in and subscribe blindly to the newsletter unless you're purchasing a new device or if you are physically updating your device. But I'm told that is actually coming soon. So stay frequently on our website. It's nddmed.com. And all of those firmware releases for the Easy One Air, all of those are going to be on that customer support download tab. So you can check on your device under the About tab what version of software firmware you're currently running and compare it to what's on the website, just to make sure that you are running the most up-to-date version. And again, keep an eye out for that subscribe button, because we're hoping to get everybody on board with a newsletter soon. So they're kind of doing some work on the website, kind of revamping some things, and that's definitely something that we know is a need, is that communication of when these releases come to everyone.
Absolutely, great question. Right, and our kind of rule of thumb about our software, I usually say we usually have 1 to 2 releases a year. So if you have not done a software update in 2 years, there's releases for you to update.
Yes,
so sure. But usually 1 to 2 we do a year. One of our famous questions is, what does the error message "do not hesitate" mean during spirometry? And when we go and train, and Jess, you can add to this.
Oh, yeah.
The biggest part when it comes to spirometry is, we ask the patient to take a really deep breath in and blast hard as fast as they can. Well, you're supposed to get 70% of your air out in that first second. It's called an FED1 measurement. And what happens is there's a hesitation. So the patient takes a nice deep breath in, which we've seen them do, and they kind of hesitate. And that hesitation means that you did not get that air out in that first second. So it asks you to do it again. Jess, am I forgetting anything?
Yes, 100% correct. I think that's the most common error that everybody sees. It's like people think, or they stop, or something happens, and they don't get that air out right away.
And if any of you were trained by me, you've seen me take a nice deep breath in and I wake them up, get them exhaling. It's a fast exhale. Like I said, you're supposed to get 70% of that air out in the first second of that exhale, called FEV1.
Right, you know, and that do not hesitate, we get that question a lot. You know, some of the other common error messages that you might get are to blow out longer, which means the patient simply did not blast out until they got to a point of plateau. Or another one that we see frequently would be an abrupt end of test. A lot of times you'll see that if the patient coughs and takes the mouthpiece out of their mouth, or if they've just had, a lot of times they will take that deep breath in and don't quite understand to take it out of their mouth. Anytime that maximum exhale all the way to plateau hasn't been met, you're going to get an error message of some sort. And do not hesitate is pretty popular.
And the great news about if you guys are on our software, if you look under the trial, there's a purple box under the trial number. If you push that, it will actually give you the problem and the solution on how to fix that. So whether you're a nurse manager or a physician or just the nurse, and maybe someone at the staff is having some difficulty getting good testing and you wanted to see what was going on, again, if you're in the patient's test screen, under the trial, there's a purple box, you push it and it brings up what exactly the problem and the solution is to fix it. It's a great, helpful hint on that new software we have.
Yeah,
so
absolutely.
Definitely check it out. And the next question is, does NDD's new inline filter solution affect the accuracy of the spirometer? And the great news is no. And our team has done a fantastic job of getting a 24 waveform testing to test those filters. We tested over 20 filters. If you have not seen that, our filters, the new filters that are added on the spirometer to the end of the mouthpiece, I suggest that you go onto our website and check it out. But we meet all of ATF standards. The testing is reliable and accurate. Don't be, don't think that just because putting that filter on the end is going to affect any of the patient's testing, because it does not. And all the proof is on our website. We have a great job of making sure that you guys feel confident with our accuracy with filtering.
Right, and this was actually a little bit of a two-part question. You know, we had this specific question asked, and then we had a very similar one about how do we account for dead space within a device? How does that affect the accuracy in your measurements? And like Darren said, with our spirometers, the Easy One Plus and PC and Air, adding the filter to the back end virtually has no impact on the accuracy of the device. Now for the Easy One Pro and Pro Lab, we're actually adding the filter to the front end of the device just because of how the device goes together.
Yeah.
That's the only place that we could really place it. And if you're using the inline filter solution for the Pro and Pro Lab, there is actually a software update that will compensate for that dead space and give you those accurate results for the Pro and Pro Lab with the filter as well.
So if you are a Pro Lab user and you want to add that second or that double protection filter to the front of the mouthpiece, just know that there is a software update that goes along with those, and feel free to reach out to one of us to help you do that.
Right, and any of these filter questions, I mean, I know it's a lot of information. We actually, our call last month was on filters, and so that webinar is posted on our webinar page on the NDD Med website. And then there's also the COVID-19 resource page on the website where you can really dig into some of those tables and see those waveform testing and really kind of get a little bit better of a picture of what went into creating that solution.
Absolutely. Right. So those are some of our top frequent. Now we'll go to the live question.
All right, so I am actually going to stop the presentation and just so that I can see everybody on the team's faces while we are working on this.
We can see each other now.
And then Joy, if you want to, Joy is going to be facilitating some of this live Q&A. So Joy, if you want to read us a question, I hope there are some.
There are. We have a few.
Yay.
And not surprisingly, they do focus around filters. So the first one is there a new filter for spirometry testing? This was asked early on, so you may have already covered it, but maybe good to just go through it real quick too.
Yes. The answer is yes. So for any of our 3 spirometers plus PC or Air, yes, we do have it's a double protection inline filter that again goes on the end. So our website, if you go to nddmed.com, it's the first thing that pops up about filters, where to order, who to call, pictures, we have webinars on it. So yes.
Yes.
Next question, and thank you very much. What percentage of your customers are actually asking for filters? Are existing customers calling you to ask for filters, or are new customers asking for filters with a new purchase?
Jess?
Me?
Yeah.
I don't know.
I would say it's 50-50. I don't know. I think a lot of people are, I had a conversation with a doctor in New York and kind of went back and forth between should she get them, should she not get them. I didn't think she was going to get them, and then she decided to get them, just to have that option. Because again, like the discussion we had is, if the patient coughs, which is pretty common with pulmonary function testing, and they take their mouth off, that filter isn't doing anything and it's going out into the air. So I think it's probably a mix.
Yep.
You did end up getting the filters though, so. How about what you guys are seeing with your new sales coming in?
Yeah,
Kind of a little bit of both?
Yeah, Kaylee, what are you seeing?
So pretty much the same thing that Jessica said. A lot of my customers they're using PPE as their first line of defense.
Yes.
Honestly, an N95, that is your source of protection. The filter is it's an extra, definitely an extra layer of protection, but just as you said, if the patient takes it out of their mouth, you definitely want them facing away from you, and you want to have that N95 mask on.
Yeah, I should have said that. PPE is most important.
Yep. All right, Joy, over the next one.
Next question. Do you have BVF filters for the Easy One Air, so bacterial viral filters for the Easy One Air?
The Easy One Air.
Yes.
What our filters are? I did. Yeah.
Yeah. I'm like, wait, is that a good question? Yes.
Is that your question?
That is what the filters that we have are. With the easy with the spirometers, you are able to use any filter that has an outer diameter of 35, correct? Yes. Inner diameter of 30 with our adapters. The ones we are providing are the A&M Systems filters, which of course you're welcome to purchase those from us at this time. But your choice of filter, if you already have a filter that you use for other applications and it fits that diameter for our adapters, then you're welcome to do that.
We just have the AM systems that Jamie's talking about. The one that we ship out is the one that we've done extensive testing on to make sure it still fits and meets ATF standards.
Correct.
You will need that adapter, that customized adapter.
Yes. Yes.
We have a comment that NIOSH training also goes through all those types of error messages.
Yes.
So in more detail?
Yes, definitely. Yes. And if your NIOSH training is great, we all take it. It's a wonderful, if you have a staff that's doing a lot of spirometry, highly recommend the NIOSH course. They do a wonderful job of making sure that you understand all aspects of spirometry testing.
And on our website, we have links to the different NIOSH courses.
Yeah.
Next question, has there been a PFT/spirometer protocol for discharge of COVID hospital patients?
Ooh, not that I have seen. On the research side, I'm seeing, applications, in the research setting, testing patients who are actively ill, and then afterwards, at 6 weeks, 10 weeks, setting up a monitoring type of program for COVID patients. But I actually have not heard of anybody using spirometry as part of a protocol.
No, and I think we've had many physicians contact us about doing studies. I know Jess has had some on the East Coast about actually testing active COVID patients. We also have some studies that we have on our website, which has actually been very interesting, is they're doing spirometry and DLCO. And it really shows that DLCO is a value that changes with every COVID patient. Some spirometry stay normal or the same, but a sharp decline in DLCO with active and post-COVID patients. So actually very interesting or another reason it's important to get a DLCO baseline for those patients who are highly at risk of catching COVID, is to have a spirometry and a DLCO, because these preliminary studies that are coming out showing that DLCO is very much affected by COVID.
Right. Has anybody else heard anything along those lines, Kaylee?
Yeah, so actually here in Arizona, I do have a hospital. They are not actively testing the patient until they're discharged, and once they are testing negative, they are having them actually come back regularly, I think every 2 to 3 weeks, to go ahead and do flow volume loops on them and see how they are recovering post-COVID-19. So
yeah,
I am seeing something like that.
Yeah.
Yeah, nothing in the Midwest that hospital-wise?
No.
No.
Not that I know of.
Okay, that's a good question.
Good question. That's a good question. Next one, go ahead.
And that about wraps up our questions.
Oh, okay. Well, that works. Let me get the presentation back up here. Well, thank you guys so much for participating with us. Darren, I just wanted to have the slide up here. We weren't going to go into a lot of detail about actual products in this, but I know if you guys have further questions, you can reach out to the sales team. Everybody's contact information is going to be in the follow-up email that goes out. I know everybody would be happy to get your questions answered, just so that everybody can get back to testing patients and testing safely. Do you have anything else to add to that?
Other than, again, with the retraining with Jessica, great opportunity to get your staff trained, not only with Jessica, again, go to the links for NIOSH, but the other great part is we have local reps in every single state across the United States that know our equipment very well. So if you need someone to come in or are looking at upgrading your spirometer to a DLCO device, we are more than able to come in and do a demo or also do a virtual demo. And again, with our local reps, you always have someone there to help you as well. And of course, our awesome tech support is always available for any kind of questions as well to help the software.
For sure. So just some key takeaways from today. I hope you enjoyed. I know it was kind of first day of schoolish, but I hope you enjoyed meeting the NDD sales team and just learning a little bit more about everyone. I hope you have a better understanding just kind of how customers all across the country, you know, everybody's in the same boat. Everybody is at different phases of reopening their PFT labs and getting patients in. So I hope that that was helpful for you guys. Another thing, I hope you were able to take something away from the top customer questions, and I hope that you were able to benefit from the live Q&A as well.
So again, thank you guys for getting on the webinar again with us this month. We really enjoyed doing these with everybody. It gives us a great opportunity to connect with people and customers who are using our devices. If there's any questions that you have after this, again, you'll get an email from us, but also you can contact us at neddmed.com and find our cartoon characters to reach out to us.
Yeah.
They may not look like them anymore.
Well, thank you so much, NDD sales team. Thank you guys for doing this with us. We really appreciate it. I know it's not everybody's most favorite thing to hop on camera, but I appreciate you guys so much, and just thank you for spending your afternoon with us. So
Thank you.
all right, thank you guys. Have a good day.
Thank you. Bye, everybody.
Thank you guys.